Are you aware of the hurdles faced in treating acute myeloid leukemia, a rapid and aggressive form of blood and bone marrow cancer? Despite significant progress in chemotherapy and stem cell transplantation, a favorable prognosis remains elusive for many patients. This has led to an urgent call to action for novel therapeutic approaches, and recently the spotlight has turned to natural remedies such as Siberian ginseng and its potential anti-cancer properties. To fully appreciate the potential of Siberian ginseng, we first need to comprehend the formidable foe that is acute myeloid leukemia. This fast-growing cancer is marked by an explosion of abnormal myeloid cells in the bone marrow. These cells crowd out normal blood cells, leading to fatigue, weakness, and a heightened susceptibility to infections and bleeding. Current treatments, including intensive chemotherapy, have been unable to significantly lower relapse rates. This makes it imperative to explore alternative therapeutic avenues. Enter Siberian ginseng, or Eleutherococcus senticosus, a medicinal herb native to the Siberian region of Russia. Known for its adaptogenic properties, Siberian ginseng has been a mainstay of Russian and Chinese herbal medicine practices aimed at boosting vitality, resilience, and longevity. Its adaptogenic, immunomodulatory, antioxidant, and anti-cancer effects have been recognized globally. So how does Siberian ginseng potentially aid in the battle against acute myeloid leukemia? Although research is in its early stages, there are several promising mechanisms to consider. Firstly, Siberian ginseng is a known immunomodulator. It enhances innate and adaptive immune responses against cancer cells. By activating natural killer cells, T cells, and macrophages, it may facilitate the immune system's detection and elimination of leukemic cells, potentially reducing the risk of relapse and improving treatment outcomes. Secondly, Siberian ginseng's antioxidant properties help combat oxidative stress, a key player in the pathogenesis of leukemia. By scavenging free radicals and mitigating oxidative damage, this medicinal herb could protect cells from malignant transformation and enhance the efficacy of chemotherapy and other anti-cancer therapies. Thirdly, Siberian ginseng exhibits anti-inflammatory properties, which could be crucial given the role of chronic inflammation in leukemogenesis and tumor progression. By suppressing inflammatory signaling pathways and reducing the production of pro-inflammatory cytokines, Siberian ginseng may inhibit leukemic cell proliferation and enhance the efficacy of conventional treatments. Lastly, preliminary studies suggest Siberian ginseng's potential to enhance chemotherapy sensitivity. By modulating drug efflux mechanisms and promoting apoptosis in leukemic cells, it could augment the cytotoxic effects of anti-cancer drugs. In summary, while the research on Siberian ginseng's effects on acute myeloid leukemia is still in its nascent stages, its immunomodulatory, antioxidant, anti-inflammatory, and chemotherapy-enhancing properties make it a promising candidate for future research. Keep a watchful eye on this space as we continue to explore the potential of Siberian ginseng in the battle against acute myeloid leukemia.